Welcome to the world-renowned Invest in Her podcast with your host, Catherine Gray. Catherine is a keynote and TEDx speaker, author, executive producer of the movie Show Her the Money, also CEO and founder of She Angel Investors and co-founder of the She Angels Foundation. Our weekly show of powerhouse women, founders, funders, and change makers is sure to inspire you. Let's go.
Welcome to this week's episode of Invest in Her. I'm your host, Catherine Gray, founder of She Angel Investors and co-founder of the She Angels Foundation, as well as executive producer of Show Her the Money. And today I have on some extraordinary guests. First of all, I have on another filmmaker. Her name is Meredith Yinger. She is a Telly Award winning director, documentarian, and founder of She TV. I also have on Dr. Maria Uloko. She is a board-certified urologist and one of 7 urologists globally providing surgical and medical management of sexual dysfunction for all genders. And so you're probably wondering, why do I have these two on together today? And we're going to tell you right now, because they are working on a new film. It's a project called Vulva La Revolution, and we're going to talk about what that's about. Right, ladies?
Yes.
Yes.
We're so excited.
So we all met recently. Well, I've known Meredith for a long time, but the three of us met recently together at a She Angels Foundation event because we gave a grant from She Angels to this endeavor, this film endeavor. So let's talk about what this film Vulva La Revolution. I'm sure not this first one to say that. What it is, what it's about, why it's so important. I absolutely loved learning about this. I'm so glad that we did a grant to help get this off the ground. So ladies, take it from here and give me an explanation about what this revolution is about.
I love it. Well, thank you. We're so excited to partner with the She Angels Foundation, and not just for the grant, but for beyond, right? When the film is finished, we're going to partner and travel for a nationwide screening tour involved with workshops and conferences and events to the places that the She Angels Foundation is setting up or has chapters. So it's very exciting that we've kind of already got the distribution mode in action, so we can kind of build backwards for this project and really build out the audience. But before I get too carried away, I'll tell you what the heck this thing is about.
Yeah, because this is really an issue that's so important to every woman listening.
Yes.
And so, yeah, let's dig into that.
So Vulva La Revolution is our documentary film that sort of exposes the historical biases, the medical neglect, the policy failures, examining like what medical gaslighting is, why we experience this, as well as looking to femtech entrepreneurs and grassroots organizations that are sort of bridging the gap to where healthcare is letting us all down, and kind of envisioning what an equitable healthcare system even looks like.
Well, Dr. Maria, you are certainly an expert in this arena. And, let's talk about that, because it's so prevalent for women to get gaslighted. And I think what we are talking about here is, you go in, you're like, I have this problem with my private parts or whatever. And they're like, no, you're fine. Don't worry about it. They try to fix everything the same way. Isn't that part of the problem?
Yeah, yes, it is. There are so many layers to this issue. I think one of the biggest things is stating the problem, right? People with experiencing vulvovaginal issues, so that can look like pelvic pain, that can look like recurrent urinary tract infections, that can look like bladder issues, urgency, frequency. It could look like recurrent yeast infections, recurrent vaginal infections. These people are not small. It's 85 million people in the United States today are experiencing these symptoms. On average, it takes 7 years to get a diagnosis, 3 doctor's visits or more, and $20,000 out-of-pocket costs. And one of the biggest reasons for this is that we leave medical education without really learning about one, female sexuality, and then also really honing in on the intricacies of the vulva. And that most people don't even know what the vulva is, and that's
Part of
uh
the problem.
medical. Yeah, that's a huge part of the problem. We oftentimes think it's the vagina, and these are dirty words. We don't say it, but it's actually these are body parts.
Yeah,
These are body parts.
sure. Just not for nothing. I'm sure people are listening right now going, I can't believe they're talking about.
Yeah, yeah.
Okay, well, surprise, we are.
Yep. Get used
Um,
to it.
Yeah. And it's this isn't just sex. This is your urinary health. This is your pelvic health. This is your colon health, your bowel health. This is such an impactful part of your life, and yet we don't talk about it. And one of the coolest things for me as a physician and surgeon that treats all genders was understanding how literally your genitalia impacts your healthcare. What kind of care you get is directly impacted by your genitalia, unfortunately. We know that there is medical bias. We know that there is medical sexism. The data shows it, but we're really just calling it out and saying the quiet part out loud. That's what I love about research. So about the work that I do is just really saying the quiet part out loud because our goal is not to call out, it's to call in. It's to wake the medical education system up of, wow, we are not educating our physicians about this very important part of the body to then be able to help patients. We actually did a study that found 75% of the people that took our study, we asked medical doctors who were in different specialties, gynecology, urology, internal medicine, dermatologists, ER doctors. These are all people that these patients are going to seeking help. And we just ask them basic questions. Do you know what the vulva is? Do you know the different parts? Do you know how it works? Do you know different disease states? And we found up to 75% of these doctors who are very amazing, smart, credible, want to do well in the world, didn't have the education or training or knowledge around this. So if your doctor doesn't have the education or knowledge, how are you, the patient, supposed to get diagnosed? And so most doctors don't even know that they don't are leaving training without this training. I learned in my fellowship, that was after 13 years of medical education. And my last year of training, that's when I started learning the actual parts of the vulva, how they work, how to diagnose these conditions, and how to treat. And my mission is to help every physician, help every patient know these things to get diagnosed, to live a better life. It makes doctors better clinicians. It makes patients better humans and happier humans when they know this information.
Well, one of the things at this event I was at that I met you two at, and first, of course, when I walked in, I'm like, this movie's about what? But then I was really interested because you were saying, a lot of people have UTIs on a regular basis, and often it's
Hmm.
because of the vulva, and that
Hmm.
it's just like a swollen vulva or something like this is the information I got that day. And I'm like, what? Why aren't people talking about this? Great, you're making a movie about it. I always say storytelling, filmmaking is one of the best ways to educate people because they're learning in an engaging storytelling kind of way.
Right.
That's what we're doing with Show Her the Money with venture capital. Nobody wants to talk about these things, whether it's venture capital or your vulva, but they do want to hear human stories
Hmm.
that unfold and explain what the issues are, right? They demystify it, right? Meredith, you've made some other great movies, Scars Unseen, which won a 2024 Telly Award. Um, and also you did a TV pilot that was one of the best TV pilots at the Indie Cinema Festival in Cannes. And now you're on to this Vulva La Revolution film. And what made you decide to take your talents to create this film?
Yeah, I love that question. And I think you kind of already answered it in terms of we're not talking about this. And I think my mission really is to tell untold stories and like why aren't we talking about this, right? Like information is power. And I feel like especially with this film, like it affects 100% of those that have a vulva. Like we should all be caring about this and, wanting to do better and educate ourselves, empower ourselves, and also like empower each other. Maria and I talk about this all the time, that there's so much misinformation out there. And when I first met Maria, I learned more about my body in through 2 minutes of talking to her than I have in my entire life. And I think, I do a lot of research. I'm kind of a nerd in terms of that. But if I don't know this, I think a lot of my friends don't know this. A lot of my family doesn't know this. A lot of the generations before me, like I'm educating them now about what I'm learning in the process of creating this film. And I think it's really important that we get the correct information out there and that we empower to each other to be our best advocate, because the cavalry's not coming. We are the cavalry. So we have to stand up and fight for better care.
I can imagine you're out there telling people, yeah, I'm making a film about vulvas, and they're like, oh, about cars, and you're like, no, that's not the topic. This is vulva. Let's get that straight.
Yeah. I think it's funny too, because I tested out on like my neighbors and folks to give them just to see the reaction, of like the guys in my life. And also once I talk about it, it's like a very clear understanding how Maria said that all of our systems are connected. So this is not just a sexual health issue. This is a women's health in general issue. And it affects the whole body, the whole person. Everyone's like, quality of life is impacted by this.
Absolutely. So, Dr. Maria, you are the CEO of MUND, M-U-N-D. What does that stand for?
Maria Uloko, MD. It's pretty straightforward.
Okay. But your focus is on sexual medicine, is that right?
Yes. So I say my job is to make sure that everyone's having great sex, whatever iteration of couple or personal. That is my life's mission and that is my goal. And yes, a lot of my work is very fun, but a lot of my work is listening to stories of heartbreak, medical dismissal, medical gaslighting, and oftentimes having to witness how the medical system and the lack of education and training directly impacts my patients. And not just my patients. When Meredith said it perfectly, is that 100% of people with a vulva will have some sort of sexual dysfunction, will have some sort of issue, whether that's urinary, that's sexual, that's bowel. All of this is related to the vulva, and yet it takes so long for them to get a diagnosis. These Honestly, listening to people's stories is what radicalized me to say, like, I have to do something. I have
And this
to
is at
make
any
change.
age, right? At
Yeah,
any
this is at any age. And then the likelihood of something going wrong increases as you age. So it's coming for all of us. It's coming for all of us. If you haven't experienced it, you will. So this is one of those things where I tell everyone I'm constantly talking about it. And I'm not constantly talking about it because I just like to talk about it. This is
You're on a
impacting
mission.
someone in life right now. And the more that you educate yourself, the more that you can advocate for yourself and get help. Because I have to sit with people if they've been suffering for 10, 20, 30 years, just looking for someone to first believe them and then also to then cure them. And that's where I'm oftentimes a lot of people's last stop. I'm their last hope. And that's a heavy responsibility, a privilege, and also a heavy responsibility. And my goal is to help them that reimagine a world where 10, 20, 30 years ago, when they started having symptoms, they went to the doctor believed them, they knew how to diagnose, they knew how to treat, and then they were done. They're cured. That's amazing. That's the vision I want in this world. So my private practice, I see patients there, and then I have a health tech company where we're using digital health and AI to scale what I'm able to do in my clinic to the rest of the world.
I love that. So if they want to go to your clinic or they want to use this AI product, how do they access that?
Yeah. So if they want to go to my clinic, they can go to my website and book directly with me if you're in the state of California. I can diagnose and treat. But if you're outside of the world, I do educational consults where I act as a second opinion in a way of just like teaching you about your body, teaching you about things, because a lot of conditions are just education. My UTI work and my UTI research, which I'm really excited about, is showing that a lot of what we're calling recurrent disease, recurrent UTIs, are actually related to the health of the vulva. And if we fix the vulva, we can actually fix your UTIs and stop that. So I give a lot of consultations
Yeah.
around that education work. Um, and
And
then
what is your website? Because they're going to want to know.
yes. So it's my first and last name, Maria Uloko, MD, .com. And
So that's
then
ULOKO. So mariauloko.com. Is
mhm,
a doctor in front of it?
nope, MD. So Maria Uloko, MD.com.
Oh, MD.com.
Mhm.
Okay, great. And
And
also, so I know you have something called, and it's up here on your screen, Vulva AI.
yes,
So VULVAI.
yes.
What is that?
Yeah, so we're the first digital healthcare platform that is created by a urologist like myself with vulvar specialty. And I'm also a two-time award-winning researcher in vulvar anatomy and physiology. I eat, read, study the vulva quite a bit. And so because of that, and I created one of the first vulvar sexual health centers in the United States run by a urologist like myself that openly accepted insurance. And that was a really, really humbling and beautiful experience because I was like, okay, well, maybe this will work. Let's see how it goes. Within less than 2 years, I'd seen 2,000 people, had a year and a half waiting list. And that such a high volume of patients, was so good for me because it actually made me have to work really, really hard to like really hone in my diagnostic skills. And so what I realized is that everyone has an algorithm. My brain works in the way of an algorithm. So I was able to create a really solid algorithm for diagnosis and then teach and train an AI model on how to do that. And then also create educational modules for physicians, for patients, because a lot of vulvar conversations are really confusing and they don't have to be. And so what I love is I love teaching. And so we have a teaching advocacy platform for the patients so that they know exactly what's going on in their body. They can figure it out. They can also get the language on how to advocate for themselves. Hey, doc, I think I have this condition. I need these tests. I need this imaging study. Let's work together to find the diagnosis. Because currently patients are going to Reddit, they're going to Facebook, they're going they're asking their friends, they're crowdsourcing diagnosis. Instead of doing that, you come to our platform, we give you personalized insights on what's going on in your body, and we help you navigate how to get diagnosed, how to get treated. And then our
And
goal,
they would just Google
Vulva
Vulva
AI.
AI.
Yeah, yep. And then
Vulva
our
AI, VULVAI. Very clever. And
yeah.
like you're saying, because you mentioned Reddit and things like that, which are such created mostly by men. And so it probably doesn't even properly address the vulva for women, is my guess. And so what you're doing is so unique
Mhm.
to addressing this problem. And it sounds like it's for both patients and for doctors.
Yeah, so we have the ability to teach doctors. Doctors that want to learn and train can utilize our modules, our training system. Our goal is to become a full service vulvar clinic doing diagnosis and treatment digitally, which I think we have the technology to do. A lot of these conditions are misdiagnosed, misclassified as chronic, never going to get better. But if you just listen to people's stories and you just think very like put your Sherlock Holmes hat on, you can diagnose and really help so many more patients in a digital platform than even our current model right now. So that's what we're building towards. So we're in our pre-seed phase. So we're in closed beta testing. We're still pretty early, closed beta testing with our first users. But we are raising a pre-seed round. So anyone wants to revolutionize gynecologic care with me, and my amazing team, come see me. Come, let's chat.
And I take it, Maria, you're on LinkedIn as well.
Yes, I
Yeah.
am.
Maria Uloko. Again, it's ULOKO. Now, Meredith, where are we at with the film? Where are you at with raising your funds? Where are you at with in the process? Have you filmed things yet? When can we expect to see this amazing movie, let's say, Vulva La Revolution?
Yeah, yeah, yeah.
Right? Okay.
You got it. Yes, I'm so excited. We actually will be filming Dr. Maria's interview in the next couple weeks. And then we are currently fundraising as well for the remainder of production funds. We're kind of doing a creative way in bringing corporate sponsors or investors on board that are aligned, whether that be with their company mission, their product, or service, so then they can be part of the film and also the exhibition aspect when we do the nationwide screening tours and workshops, because we want people to be angry from this film, but then also to be able to channel that anger and have tangible resources and places they can go, products they can look up, organizations they can support, like Maria's, to really join the revolution and be part of it. So we're looking to kind of have those kinds of folks join us right now. So if that sounds like you, reach out to us and we'll definitely make something happen and welcome you gladly to the revolution, because it's going to take all of us.
It is. And how do they reach out to the revolution and become part of it?
Yeah, so you can contact us. I am on LinkedIn, but also you can reach out through our SheTV website, so shetv.me, or send us an email. Our email's on our website as well, and we can chat.
And you said it's shetv.me?
Yes.
Or media?
.me.
.me.
And shetvmedia.com also.
.com. And of course, Meredith Yinger is Yinger if you're looking her up on LinkedIn. So, join this Vulva La Revolution. Let's get the information out there to solve these issues for women young and old, and revolutionize the ability to diagnose this and get people feeling better. Dr. Maria, you tell everybody you're all about everybody having great sex and you have those great glasses on. I'm sure everybody wants to invite you to their cocktail party.
I do have many dinner party conversations. Yes. I'm a hoot at a dinner party.
She is. I can confirm this. I can confirm.
I've been to this one gathering and I can already confirm it. So yes, be a part of this, everybody. This is such an important endeavor. Once again, women innovating things that don't exist that are going to revolutionize women's health. And again, it's Vulva AI, so that's VULVAI, and you can also find Dr. Maria Uloko. You can find Meredith Yinger at SheTV. Of course, you can find me as well on LinkedIn, Catherine Gray, Catherine with a C, Gray with an A, and we are SheAngelInvestors.com, as well as the SheAngelsFoundation.org. And then finally, my movie, ShowHerTheMoneyMovie.com. That's all about, investing in women through venture capital. So all of these amazing things that we get to work on to help make the world a better place, not just for women, but also it ends up benefiting all genders, because what is it they say? Happy wife, happy life. So guys, tell your wives about this, your daughters. There's a lot of girl dads out there. And of course, just tell your friends about this incredible innovation that Dr. Maria is working on, and that Meredith is shouting from the rooftops through her incredible storytelling through this movie. Thank you, ladies, for being wonderful guests today.
Thank you for having us.
Thank you so much. This was awesome.
Thanks, everybody. Make it a great week.